As Carrot's CMO, Asima oversees medical operations, including clinical navigation, and the company's telehealth program, an expansive network of eligible clinics which offers access to more than 3,000 reproductive endocrinologists, urologists, adoption experts, mental health experts, OBGYNs, doulas, and midwives. Asima's work has been published extensively in academic literature and internationally on a wide range of topics related to infertility, reproductive and hormonal health, gynecologic malignancies, and patient safety. Asima, hi. Thank you so much for joining us today to talk about Carrot and also raise awareness for infertility. How are you doing today?
I'm doing well. Hope you're doing well as well. And very excited to be doing this webinar with you today.
I can't wait to chat with you today about Carrot's founding story and about infertility overall. So I know that before you became our fearless leader at Carrot, co-founder and chief medical officer, you trained at Yale in obstetrics and gynecology, and also completed your fellowship training in reproductive endocrinology and infertility at UCSF. Can you tell us a little bit more about your journey into medicine?
Of course. Honestly, I could go on and on about what led me here, but I'll focus on some key points in my life that helped shape my journey. It's funny because growing up, I actually did not want to be a physician. I was extremely interested in genetics and wanted to be a geneticist working in a lab and doing research. However, a few things happened that changed my mind. My aunt, who lived in Pakistan, who was honestly the kindest soul you could have ever met, died from a postpartum hemorrhage. And even before that happened, one of her babies died a day after birth, and she also had multiple stillbirths. And when you look at the details of what happened, every account of what she went through was preventable. Had she had access to care from a resource, regional, cultural, and financial standpoint, that made me realize how much work was yet to be done to improve maternal, fetal, and neonatal outcomes globally. And I really wanted to focus on improving that in women's health. I can actually pinpoint the moment I decided to go into medicine. I was sitting in class and read this line that whoever kills a person, it's as if they've killed all of mankind. And whoever saves the life of a person, it's as if they've saved all of mankind. And that really stuck with me in the sense that a single life impacts an entire community, the entire world around them. It's not just that one life that's impacted if it's lost, many lives are. And it just made me realize the value of each and every one of us to our loved ones and our communities. And I decided that even if I were able to help one person lead a healthier life and help them avoid negative health outcomes, that I'd be achieving my goal. During my journey into medical training, I spent time doing research on patient safety and what factors impact outcomes and can result in adverse events. I went to the World Health Organization and worked on a project to help understand the mechanisms that need to be in place to reduce maternal mortality. During my training as a reproductive endocrinologist and infertility doctor, or REI, which is a lot easier to say, I learned about cost-effective treatments that can be used in resource-limited settings to achieve fertility goals. And honestly, my time at Yale, where I did my residency in obstetrics and gynecology, gave me a lot of insight on high-risk pregnancies, things to prevent them, how to manage them, and the impact they have on the person carrying the pregnancy and the baby. And during all this, I also realized that in the realm of family planning and women's health, fertility and particularly infertility was not getting the same level of attention or coverage. But also, let me be clear, when it comes to fertility and family forming, it's not just a women's health issue, it impacts everyone.
Totally agree, Asima. And thank you so much for sharing some about your personal background, your upbringing, and your education. I see so many aspects of your background, both personally and professionally, in the culture and in the mission of Carrot. And that brings me to my next question, which is, how did you meet Tammy? Carrot CEO and your fellow co-founder.
It's funny that you mentioned how my background is seen in the culture and mission of Carrot, because the way Tammy and I met was actually related to all of this. So we both met in 2015 at the annual American Society for Reproductive Medicine, or ASRM, meeting. And ASRM is the go-to society for reproductive professionals and fertility health providers. And that's where we learn about and share best practices and treatment guidelines. And the session that we actually met each other in was on access to care and cost-effective methods to provide fertility care.
So after meeting at the Annual Society of Reproductive Medicine in 2015, how did you two actually come up with the idea of providing fertility and family-forming benefits to employees?
Yeah, well, we both agreed that there was much work to be done to increase access to fertility and family forming care, her from one perspective and myself from the provider perspective. There was a lot of friction in the process. Patients needed more education and support around multiple things like injections, symptom management, side effects of medications, bleeding. And most of them felt extremely stressed, depressed, or alone. Some data actually shows that the psychological impact of an infertility diagnosis can be similar to that of a cancer diagnosis. And that's just how deeply it can impact an individual. Together, Tammy and I discussed multiple solutions on how to tackle these issues. And then there was Carrot. Carrot would help solve one of the biggest barriers to access, which was the financial piece, but also provide education, support, and care coordination.